You lead them through a process.
Yeah. And it involves, if you want to get technical, things like Michael Yapko does a lot of things like this in terms of, it's kind of a combination of cognitive behavioral therapy, self-hypnotic training, so you're teaching somebody to do this, but they're not like in a trance, essentially. They're more or less aware of what's happening, but it's sort of an opportunity to go into a different kind of state where you're relaxed enough to really go on a vision quest, to really leave your surroundings. And the people have this sense that time sort of collapses, and they feel like time is it changes for them. They can't believe that 40 minutes has passed or whatever, or 45 minutes has passed. They feel like they've had a real journey. So that can happen. The other thing too is doing a lot of somatic work and allowing somebody to connect to their heart, going on a heart journey.
Say more about that. What does that look like and sound like, and how is it for someone to go on a heart journey?
A lot of times, a lot of people, myself included, we're trained to really operate from the neck up, to be intellectual, and to really value our thoughts, and to not really connect to what we really feel inside, And it takes a lot of training to be able to drop down into our hearts. I've had to spend most of my life learning how to make that shift from, being cerebral, and getting, recognized that way, to really dropping down in my heart. And for me and many others, a way to do that is to connect to where we feel our feelings in our body, to notice where we're getting activated emotionally. And so I think allowing ourselves to really connect somatically to where we're feeling our feelings is very important for being a Magellan, being the Magellan to ourselves, going through our bodies, where do we feel things, touching that part of ourselves where we feel our feelings, using that as information, so when we're reacting to things, people, challenging times, situations, we know where we're coming from. Like, let's say fear. Where do I experience my fear? Is it here? Is it here? Where do I feel that in my body? And so sometimes we don't know what we're feeling, particularly speaking for men, men and women, we both struggle with this, but as a man, I know that it's hard for us sometimes to know the range of our feelings, to identify what is the feeling I'm feeling right now. And so using the body somatically to identify that is very powerful. So mindfulness is being aware of what's happening somatically, what's happening emotionally, what's happening cognitively, how are those things happening at once, and what's happening in terms of me being able to watch myself experiencing these things. And having that opportunity, it can be very helpful. So a lot of times, Raphael Kushner is somebody who does a lot of work around that. And there's a lot of somatic psychologists who do work around this. But mindfulness involves a lot of that. It's really important.
I'm interested in hearing you share more about your own personal transformation. Did this occur in a gradual process through training and practice of meditation, or how did you learn mindfulness and mindful practice and incorporate it into your life, and when did that change, or how long did it take for that change to occur, and what happened when the change occurred?
I've been interested in psychology for most of my life, and what really initially got me interested in the field was two things. One was seeing a lot of people with great potential not utilize it. And then seeing people who use drugs and alcohol not utilize their potential. And seeing people who I knew die, in high school going back a long time ago, who are very smart, capable people who got into the drug culture and lost their minds literally. And some of them died either spiritual deaths or mental deaths, or actually literally died. And so that sadness of seeing people I cared about die, really capable people who with great potential, awoke me to the possibility that one, having a sober mind is pretty important, but it's not just not using drugs and alcohol, it's how do we use our minds? How do we use the totality of our abilities? And so I was really curious about that, realizing that how little of myself I was using, and how little of ourselves most of us utilize, what our strengths are. I was curious about strengths. and strength-based approach to feeling whole. You know, rather than looking at just from a disease model or a deficit model, I want to look at it from a model of possibility, or Adlerian model, which is looking at what is our greatest potential, you know, if we utilize ourselves. He talked about the need for superiority, so I was really curious about that. So early on in high school, I was influenced by those experiences, and then I was curious about how the brain worked in neurophysiology and neuroscience. And so in college, went off to college and really was interested in brain science and anatomy and physiology and neuroscience. And I got into meditation, you know, early on, and I found out that when I meditated, I felt better. And I knew that I felt clear in my mind. I noticed that I would be more on top of how I felt. I would handle tough, stressful situations much more effectively. And I found that I was able to relate to people in a way that I wanted to, you know, when I came from a more grounded place.
A place where you're more in touch with your feelings.
More in touch with my heart. From my heart. Yeah, not just my head, you know, and so more integrative. And so I was experimenting with these things, and you know, this is a long time ago, and certainly mindfulness and Buddhism has been around for a very long time. It's not like but you know, a lot of us have been exposed to it. But I was really curious about neuroscience, neurophysiology, assessment, testing, possibilities. You know, being able to overcome challenges, utilizing all of ourselves. So these are the things I was walking with, and how do I integrate all these things? And then. Anyway, later on in life, going through college and graduate school, I was interested in neuropsychological testing, and I was interested in therapy, and interested in the importance of relationships to self and others, and then how could we come from the optimal place. For example, you know, when we are in our fears and we're in our reactivity, you know, we are coming from a parasympathetic nervous response place and dealing with situations and people, fight or flight or freeze. So a lot of that comes from a false appraisal of what's happening at the time, or cognitive distortions in the CBT language. But from a mindfulness perspective, how can we stand back and really really gather what's really occurring right now and allow ourselves to not feel so over-personalized about what's going on, but feel to come from a place of the observing self and to talk to the fear or to notice the fear, but not make the fear us, to be able to stand back and witness what's happening without coming from that place. And then more recently, you know, certainly there's been a lot of stuff with Dalai Lama and Buddhists, and working with Harvard and University of Wisconsin and MIT and all these different schools, and looking at, you know, hard science supporting the value of mindfulness and neuroscience and meditation. And all these things have been now demonstrated to be effective in terms of helping our immune system, reducing our stress level, reducing cortisol level, allowing for people to get better without relying on medication as much, and utilizing our internal resources for possibilities, and also for utilizing therapy more effectively, and to be able to take things that don't require us to rely on a therapist and do them independently of therapy. Mindfulness, you know, techniques learned in the office can be generalized outside of the office, so people don't have to rely on us as clinicians. They can rely on themselves, and I think that's key. Is to, you know.
Wow, thank you. That was great. I'm learning much more about you just listening to the answers to these questions. Could you say more about the connection between the physiological of the brain and the heart, and how they enhance each other, or how that relates to well-being and mental health, being mentally and emotionally healthy?
Yeah. Yeah, I think there's a lot of programs, like even at the conference. Actually, it was a conference that it was powerful that you and I went to once, the Milton Erickson, you know, Foundation Conference, which is a big one every 5 years. And they have a lot of really interesting people there. Daniel Siegel spoke, and a lot of people talked about some of these concepts. But they have these programs like HeartMath is a program, a computer program. And you know, some of the advantages of a program like this, and I'm not plugging the program, I don't get a kickback, I'm just saying, you know, this is interesting research that when you can be in a what's called a coherent emotional state, which would, let's say, a grounded, whole, emotionally even place, it can lead to clarity of mind. It can lead to widening your perceptual field so you're not missing things. It can lead to a sense of wellness subjectively. It can reduce stress. And so using this...
So your brain and body work better.
Yeah, so aligning your cerebral cortex with your amygdala, you know, letting that, you know, working on that pathway, that neural pathway, so that your heart essentially is guiding your thoughts. And we tend to think of it often the other way too, which is your thoughts can affect, you know, your feelings, but it can go both directions. But allowing your emotions and your thoughts to line up together and align together so that your heart, essentially your emotions, are grounding you by creating images, let's say, that are soothing or relaxing, or you have positive associations with these images. So your heart associates with these grounded images, and your thoughts join in and feel, or are thinking that, thinking peaceful things, or looking at things as not threatening, but more, you know, as opportunities for grounding and relaxing. So when you're able to do that with this computer program, it gives you feedback instantly. It says, hey, you know, you're in a coherent emotional state. And then things like anxiety, things like depression, those types of things, which are very common that people come in for, improve. And I think that's interesting even in the gaming industry right now. There's a lot of technology that's being used in the field that I think is influenced by mindfulness. There's computer games now for ADD that you know, people will now play online. And what it does is that there's a challenge, a focusing challenge, and you keep moving up and being able to focus better. Or there's games now with depression and anxiety online that utilize mindfulness strategies and techniques and built into the computer program, into the software. So I think that I think the field is going to move in a direction where technology is going to improve so much that it's going to utilize mindfulness principles, ideas, and strategies for focusing and centeredness and being in the present moment. We'll be utilizing technology computer programming to enhance this ability. So our patients, our clients, will be able to work on mindfulness strategies, not just by sitting in an ashram, not by going to Burma, not just by having to go to a Buddhist center in Oakland or Berkeley or, you know, Mill Valley. It's about being able to do it now in your home with your laptop or your iPad, and it's going to be amazing. So I think that there's going to be amazing opportunities for people to do this, and I see an emergence of the fields of technology and psychology and mindfulness moving in this direction, and it's going to be very powerful. And I hope it helps us not rely on things that aren't as natural, like pharmaceutical medication, you know, to do the work for us. Because although I'm not against that, and I think sometimes medications are important, and I support psychiatry, and I think it's critical for some people, I do believe that we rely too much on external resources besides us to achieve these goals.